Welcome, everybody. We're thrilled to have you here today. As Hannah said, my name is Marcy Patterson. I head up our solution consulting team here at Blink. I'm actually coming to you today from one of the major hospital systems here in Kansas City, and it's always extremely fulfilling for me to get to experience firsthand the type of work that goes on across the country within our healthcare organizations. I'd like to also introduce Ian. Ian is an independent healthcare consultant and advisor who spent many years, as Hannah mentioned, in various senior roles at some pretty well-known healthcare companies. Ian, do you want to just say hello?
Sure. Thanks, Marcy. Hi, everybody, and thank you for taking time today to join us. As Marcy said, I've spent the better part of 30 years in the healthcare space in the United States. I've worked at large payers, I've worked on the provider side, and I've also worked with some of the vendors. And over the course of my time, I've led large organizations in the operations, technology, and strategy spaces, as large on the front line as almost 3,000 people. And as a result of those experiences, I've developed a real passion for ensuring that we pay attention to the frontline employees because, frankly, they are our face to our customers. They are the face of the company.
Yeah, terrific. And we're here today, Ian, to really delve into sort of the employment, frontline employee engagement challenge. And when we think about that challenge, I'd love for you to just frame it up a bit. Is this a new problem we're trying to solve? Is this an old problem we're looking to solve in new ways? Or has there been some sort of shift that is sort of bringing this particular challenge to the forefront?
Yeah, so Marcy, this is not a new problem. It's just with a lot of changes that have occurred over the recent years, it's risen to really the top of executives' problem list. I think what you really have are four principal reasons. First is an unprecedented disruption in our workforce. You've got burnout. COVID contributed significantly to that, but the burnout of resources and frankly, just some of them exiting the industry and being replaced by others. And you're seeing a significant generational shift to a lot more Gen Zers and millennials who, they have a bit more of a gig mentality and a drive to balance in life. On top of that, you've got a huge competition for workers because of the increasing demands and the reduction in supply. You've got what I refer to as a fight to the top and a race to the bottom. And by that, I mean, employers have had to significantly increase compensation, perks, and a lot of flexibility, which frankly has driven up the cost structure and made things a lot more difficult, which is why paying attention to those frontline individuals and getting them to be happy and satisfied and engaged versus looking for their next opportunity. On top of that, you've also got the demand for additional resources, not just because of COVID, but because of things like a desire for individuals to now age in place, the aging of the US population, and a desire to stay home, be treated home, and to age there. Number two is a greater awareness of the cause and effect. I think that we have developed a more acute understanding that the implications of dissatisfaction of frontline employees leading to turnover and what that means to our company, and therefore really needing to escalate our attention or elevate our attention. COVID-19, of course, had significant implications. And finally, there's a realization that what we've tried in the past hasn't really worked to drive significant levels of employee satisfaction, engagement, and loyalty.
And I've heard you use the term before that some of these employees are starting to act or feel like sort of mercenaries. I don't love that word, if I'm going to be honest, but I think you have a good explanation for why we're using that word as it pertains to some of these workers. Do you want to just explain that a little bit further?
Sure. I know that's a really harsh word and some people take offense to it, but I think, given the current state of employee satisfaction and loyalty and engagement, it's not a horrible term. Frontline employees repeatedly in surveys and interviews report a feeling of the absence or disengagement from a corporate culture. They feel underappreciated and undersupported. And as a result, we've seen a lot of those employees not being loyal and frankly, looking for the next opportunity for the next dollar. And so, that's what mercenaries do. Fortunately, these frontline healthcare workers are passionate about what they do. But so their loyalty is more to patients than the company, and that's caused a lot of challenges. Some statistics in a recent Gallup survey, they indicated that 32% of the employees said they were engaged, which means 68%, more than 2/3 of the population, said they weren't. And that broke up between two categories of people. What are referred to as quietly quitting people, who stay but are not truly engaged. And while you have their hands in what they're doing, you don't have their hearts. And so you're not getting their loyalty and you're not getting their discretionary effort. And then you have a significant portion who are actively disengaged. And that's traumatic for the population and your customer base.
So let's actually talk about that a little bit more. What are the implications of that disengagement as you've seen it, particularly in the healthcare industry, whether that be on the organization side or the patient side? How would you sort of talk to the impact that that disengagement is having?
Sure, that's a really good question, and another four-parter. I actually refer to this as the quadruple miss. Because of the implications. And first and foremost, they're on patients and their families, your customer base. And that's because as you have significant turnover, or you have people who are disengaged or distracted from their duties, their primary responsibility and what they are there to do, which is care for patients, handle customers, the families. So first of all, the patient, their lives are disrupted. They count on the frontline workers. And if they can't, or I was reading an article about a woman named Marcy who had 7 different caregivers for the same services in a 6-month period of time. And her family felt obligated to educate and inform all of those 7 different caregivers. And it's repetitive. You don't get the continuity of care, the consistency, the comfort that people are looking for when they want to age in place. And the family themselves becomes very distracted from their jobs or their other activities. And so they're potentially hurting themselves from a employment perspective and their employers.
And I'm sure the frontline worker feels that too. The family's frustrated, and the frontline worker coming in is going to feel that frustration, feel responsibility for that frustration. So that affects sort of both sides of that equation.
Yeah, so the frontline worker would be the next. And exactly to your point, about 100 years ago, I went to a webinar, or it wasn't a webinar at the time, to a conference, and somebody said, you work 8 hours a day, you sleep 8 hours a day. Do you want to go through 2/3 of your life either pissed off or unconscious? And when I think about our frontline workers and the challenges they have in feeling unsupported, disengaged from the culture of their company, it's bad for them. They don't want to do a bad job. They don't want to be distracted, but they have lives too. And the lack of support is problematic, and it's not, frankly, good for their health. You mentioned the third one, which is the company. Of course, the company suffers, and the company will suffer because they spend a lot of their time, energy, and effort in recruiting, hiring, training their employees over and over and over again. And of course, with the salary changes and having to put perks in place, that's driving up their cost structure. And the lack of resources to meet the demand that they have out there has a negative impact on their revenue. And it also potentially has an impact on their reputation, their market reputation, as care may not be of the quality it needs to be. And people complain about the constant turnover that's going on.
So I know, oh, I'm sorry. Go ahead. You had a fourth.
I'm sorry. The fourth people or area of folks most impacted, frankly, are all of you on the telephone or the conference today. And I say that because you're the leaders of critical resources in an organization, and those resources are disgruntled. And I learned a really long time ago that as you move up in an organization and as you start to lead large organizations of critical frontline resources, that you lose control of your career. We believe we're in control and that we've got this planned out, but the truth is those critical frontline employees are in control of our careers. And if we don't do a good job of supporting them and making, creating the environment that they need to be successful in, think what would happen if they all banded together and went to your boss and said, in my case, if Ian comes to work tomorrow, we're not coming. Now we laugh and say, yeah, I'll be the one at work tomorrow. The truth is, it won't be Ian. It will be those critical frontline resources. So those four categories of people are all impacted, and from a dollars and cents perspective completely. And if you're worried about your career, it makes total sense to focus on the frontline employees.
And so you mentioned recruiting, and I also mentioned at the beginning that I'm at one of the hospital systems here in the Midwest. And certainly with a lot of the conversations we're having with healthcare organizations, attrition is a huge issue, is a huge cost, and recruitment is where a lot of effort is being put to help address some of these challenges. I've heard you talk about sort of some of these recruitment efforts being like pouring water in a leaky bucket, and that we're just continuing to pour water in instead of trying to plug the holes. Can you talk a little bit about the focus on recruitment and where you see that as perhaps a little bit of a long-term losing proposition?
Sure. So I use the analogy or the metaphor of a leaky bucket because turnover at the rates that are being experienced now and have been for some time, 20, 30, 50, and in some places upwards of 70%. Organizations are frankly in a panic, and they need to bring on employees, frontline employees. And so they bolster their recruiting teams, their hiring teams, their training teams. They spend money on advertising, on perks, all types of things. And it's the familiar solution to needing resources. It's the one that we're most comfortable and the one that we know. And we know what type of results we expect to get. But unfortunately, with the turnover rates as high as they are, the staffing organizations don't seem to be able to keep up with the current demand, let alone the incremental opportunities that are in the marketplace that companies have to forego. In the home health space, I actually saw statistics that said in a survey that during 2022, 80% of the home health agencies interviewed or responding to the survey indicated that there were times where they had to turn away business because they did not have the staff. And 57%, I believe it was, indicated that they had to do that frequently. And so what people do is they go to what they're comfortable with: hire, hire, hire. It's a shorter term fix, but long term, it creates a bad culture and an unsustainable culture. It's a self-fulfilling prophecy. If you use that as your primary solution, you're going to need to keep doing that, keep investing.
So let's talk about perhaps some other solutions. If recruitment is not the solution, in your mind, what are some of those other solutions, and what have you seen work?
Okay, so the first step in the process I think, or towards having solutions, is for the leadership team in an organization to acknowledge their contribution to the problem at hand. As leaders, we're responsible for creating the environment for supporting our organization. It's fundamentally the old inverted pyramid, right? It's the servant leadership type of mentality. And what has to happen first is acknowledge that I've helped create the problem and that I have a key role and I am committed to, or the whole organization needs to be committed to solving that problem. And frankly, not just for the front line, but for all employees in the company. What I've seen work or what I've seen happen is people do employee surveys. And it's a step in the right direction, and it's valuable, and it gives you data at a point in time, and you can trend it. But what I've seen happen is that people spend more time debating the validity, the accuracy of the results of the survey. And there's an old saying there that if you torture the numbers long enough, they'll confess to anything. And I think, unfortunately, people get caught up in that. And we put those, movement in the survey results into bonus programs. Again, a good piece of a solution, but not the one to hang your hat on as the primary solution. The second thing that's become a lot more popular are listening tours. The challenge with listening tours, which are, again, a good step in the right direction, spending time with the front line with all of your employees, is that they're events. And so it's not a normal course of business. It's a large scheduled activity where people are going out there. Employees don't feel comfortable because it's not an expectation. It's not a frequently occurring event. And they have to happen with authenticity. And very often folks are out there rushing in, having some time, maybe having a lunch, listening a little bit, but really trying to deliver a potentially scripted corporate message. And so employees are hearing what the corporation wants them to hear, not what they really need to hear to move the dial for them to become engaged and supported. Marcy, one of the best things that I've heard has been a CEO at a non-healthcare company who made a commitment to break his time up in the following way. 30% of his time is spent with frontline workers. 30% of his time is spent with customers. 30% of his time is spent with other executives, and 10% of his time is spent with other external resources. And that's huge when you think about 30% of your time. Many of our frontline, first-line managers can't even spend 30% of their time with their employees because they have so much administrative and other activities they need to engage in. A survey from the Harvard Business Review showed that on average, CEOs spend 6% of their time with their workers and 3% of their time with their customers. So think about how much of an impact you can have on helping demonstrate to your frontline and all of your employees and your customers how committed you are to them and supportive of them if you're literally spending 30% of your time with each of those folks.
So it sounds like what you're suggesting is that some of the efforts that have been put in place to sort of drive better employee engagement tend to be a little bit point in time. You mentioned surveys, you mentioned listening tours. So it sounds like you're saying there has to be more of an effort in listening more frequently to the front line to help drive that engagement. Is that what I'm hearing? You're looking for sort of more bi-directional communication at more frequency? Is that what you're alluding to there?
Yeah, it's when I said these events. So the survey comes out, it's event. The listening tour happens, it's an event, even if it happens quarterly. It's really got to be built into the fabric of the organization. It's the, it can't be, oh my God, the CEO's here. It's, Fred or Mary's here, right? And it needs to be an expectation and something that people are comfortable with. One of the organizations that I led a number of years ago, a large healthcare customer service administrative organization, almost 3,000 people. After I left the one thing I did was I moved my office out of the corporate location and into the service center. And I took heat from the corporate office folks saying, you're not with your peers. I said, I need to be with the people who are frontline, are the face to our customers. And I was, I would walk around, I would engage with those folks all the time. And, you think it's working, but posthumously, I found out it really did work, because I ran into one of the frontline workers after I had left. And he said, Ian, we miss you here. It's not the same. He said, we didn't always know what you were doing or what you were trying to accomplish, but we knew you had our back and we trusted you. So we did whatever you needed us to do. And that's probably the best compliment I've ever gotten in my career, but it was because I lived in the same location they did. I experienced what they did. I walked around, and nobody was intimidated when Ian walked through the organization. Right.
I'm one of the things that I've seen as I've talked to different organizations, different healthcare organizations, when you think about sort of that executive level engagement and getting closer to the front line, it seems to me that one of the reasons that may not happen as often as perhaps it could is because of the sort of cross-functional nature of the front line. And you have the senior leadership at the CEO level. You, I believe, were in a number of different operations roles. You have the HR organization. So sort of that engagement could come from any of those. And sometimes I kind of feel like maybe one organization thinks the other's responsible for it. So how do you how do you approach that cross-functional nature of engagement in a large organization? And I'm curious, who is responsible for it in your mind?
So I think the answer is the same in every company. You do need to find somebody who's got the energy, the passion, and is empowered to try and lead the initiatives. But that's more of your project leader. The ownership is everybody. The ownership, and it's also in the front line, by the way, because the front line needs to have that relationship with the management all the way up and have comfort and be able to speak and share their concerns. I always tell folks, every now and then I may solve one, maybe two of the problems I don't know about, but that's an accident. Right. So I think it starts at the CEO. It's the direct reports to the CEO and all the way down to the front line, first line of their management team. Everybody has to own it because it has to be in the fabric of the company. It's just not, my responsibility, because then everybody can blame me.
Yeah, you mentioned first line management, and that's one of the things that I've seen in some of my travels is we're often talking about sort of senior leadership and their responsibility. We're talking about the front line. Is there an opportunity here to better engage that first line manager in helping solve for this engagement? And I'm curious if you've seen ways that has worked when it comes to that first line management team. I mean, do they have the same level of turnover at that level, or could we be leveraging it more?
I think it's different for many companies, but that first line management potentially may be the hardest worked and undervalued level of management in the entire company. They have a passion and a commitment to their folks and do everything that they can. But if you look at the amount of administrative work that's been burdened on top of them, on top of what they should be doing, it's tremendous. And they barely have time to try and manage their teams, do the administrative work, and then pick up the slack for their peers who are no longer at the company because of high rates of turnover and burnout. And by the way, they have families and lives too. And that balance becomes very, very difficult. But we do need to engage them. They are critical because they are the closest folks to the front line. And so if you're not getting everything you need to hear or can't get to the front line all the time, the people who know them best are the first line managers, because more than likely, they've done the job. They've been through that. They've experienced all of those things, and they see it firsthand every day. But before we can engage them, we have to make sure that they're okay. And so we need to understand what's helping them be engaged or not, or disengaged in their jobs, being dissatisfied, having high levels of turnover. Because it's really hard to ask somebody to help drive engagement, satisfaction, and loyalty when they don't feel those things to the company.
And you mentioned their administrative burden. And, I think there's an opportunity there that perhaps isn't reaching the front line. We've seen a lot of digital transformation go on within many organizations. But it seems to me that perhaps some of that transformation isn't reaching out to the front line, and some of those processes continue to be fairly manual, and as you mentioned, quite a burden on both the first line manager and the front line. Can you talk a little bit more about sort of that administrative burden, and in the roles that you've played, how you've tried to alleviate that?
Sure. So one of the first things that a lot of companies don't do, or should do but don't do, is truly value mapping activities. And so look at what we're asking people to do. Map out the flow of activities, the things that need to occur, and see where the value is being added, and where you really need people engaged, and where they're doing repetitive, mundane, routine tasks and things that potentially don't even need to be done. And so if you go through that process, which I did at one organization, I actually was finding that it was taking 10 or 15 minutes to do what seemed to me, an uninformed person, a pretty simple task. And so I sat and I literally videotaped it on my phone so that I could continue to go through this. And I left the service center appalled. What I was finding is that people were going into teams, then having to find the right teams, and then the right folder, and then the right document in the folder. And then they'd have to write something down and come back out and then go back in. And it was a horrible use of their time. And no surprise that it didn't excite them every morning to have to do that. And so I look at how could we leverage technology to simplify that. Sometimes I think what I would tell folks is, we're going to make your job harder so that you're going to be more satisfied and engaged. And what I meant by that is, we're going to take away the administrative, simple tasks that, are not exciting, truly not adding value, and they're not rewarding to you, through automation, through streamlining processes or eliminating things. And we effectively built a repository for all that information. And it was done on a micro level, because we did it with low code, no code type of solutions. But it made a significant difference in the productivity, the satisfaction of the workers. Frankly, the quality of their work went up. They weren't being hollered at as much by people who were impacted by their errors. But we did that on a small level. And then there are many companies and out there who can help. And that's part of where I found, the hub mindset. And that's really what Blink brings to the table. A enterprise-wide capability for creating hubs of information. Now, folks, come on. Did you actually think we'd make it through the entire thing without at least one commercial? But in all seriousness, it is the hub mindset and mentality. And at Elara Caring, as you mentioned, we did implement Blink we're able to simplify a lot of the need to communicate, what it took to communicate, and give tools to the frontline workers to be able to have them do things like create communities, have single sign-ons, single capabilities, and go one place for information versus, I've heard and read about in the nursing community where they have to do 5, 10 plus different systems during the course of the day. And so a hub mindset like a Blink solution really does help the organization and should be considered.
Yeah, I was talking to a healthcare organization out in California, and as they were sort of discussing the challenges they were looking to address, I loved how they sort of positioned it as reducing the cognitive load that comes out of some of the digital transformation that has been done, which isn't necessarily frontline focused. And so people at the frontline, physicians, nurses, healthcare workers, it affects a lot of other industries too. Instead of spending the time where we want ideally them to be spending the time with the patients, with the caring, they're ending up spending more time trying to log into a particular system or find access to this or get a password reset. And so they were talking about reducing that cognitive load so that the cognitive spend could be spent where the most value was. And I just found that a really interesting conversation.
Yeah, the thing I would say to that, Marcy, is it's the non-cognitive load.
Exactly. Simplifying the non-cognitive load. Yeah.
Right? And that's where I talk about making somebody's job harder and making them more satisfied. I mean, I've yet to find a clinician or a caregiver who said that I got into this profession so I could work on a computer all day.
Yeah. So Ian, you've suggested a few things. You've talked about culture. You've talked about senior leadership engagement. You talked a little bit there about technology and looking for opportunities to simplify. Obviously, whenever an organization is looking to sort of change an approach, because you also talked about sort of focusing perhaps less on recruitment and more on retention, that is going to potentially take investment. And I know you do come from a strategy and an operations background. As you look to create sort of a return on investment in investing in these types of programs, where have you seen that return? Have you been able to quantify that in ways that to the name of the webinar that makes sense, if you will? Sure.
So what I didn't share at the beginning is that I'm a recovering CPA.
Okay.
So I have a financial orientation in how I look at things, and I recognize, the need to spend the company's money wisely. And by investing in technology, administrative savings is easy to quantify. And so you can, the jobs that people do, if you can do it faster, if you can do more, it's easy to say, I need fewer people, or the same number of people can take on more tasks. And that's a pretty easy calculation. People have done it all the time studies, other things. But very often that won't pay for itself. Right, the investment that you need to make won't pay for itself fully on the administrative savings. And of course, no matter what you come up with, they won't be enough, and nobody will believe them in your ROI calculation to begin with. The second piece is that you can really start to look at the impact on turnover, so on loyalty, satisfaction, and engagement. So your frontline workers can be much more productive. But if turnover declines, that's tremendous, because the amount of money that companies have poured into their HR, recruiting, hiring, training, organizations is tremendous. And there's also an opportunity lost there that you may be able to reduce your staff. And obviously it's a production function of how many resources you need to hire. But if you can redeploy some of your training resources to your front line to give them skills and capabilities that enhance their ability to serve customers and patients, that can be a differentiator in the marketplace and a good reason why your front line would feel that they're appreciated and invested in. So I think that's also reasonably easy to calculate. Some assumptions that you'll have to make, a couple leaps of faith. The biggest leap of faith really comes down to what does it mean from a revenue perspective? And that's a place where if your leadership team, if your company, if your CEO, your CFO, and others don't innately believe that improved employee satisfaction, improved employee engagement, and commitment to your organization has an impact on your customers and your reputation in the marketplace and your ability to grow revenue and to capture lost revenue from the perspective of you haven't been staffed, then you're pushing a rope because frankly, they're not enlightened, and you can try to get them there. And hopefully if they engage in things like spending a significant portion of their time with Frontline and with customers, they'll understand that. But that's fundamentally what it comes down to. And you're going to have to make some leaps of faith in the revenue side. But you're not going to be perfect, and people have to be okay with some ambiguity. And so what I've been able to do in the past is say, look, if we could improve employee satisfaction by X and reduce turnover by Y, could you see revenue growing by 1%? And sometimes what we're talking about is if productivity increased by 20% and turnover reduced by 5%, could you see a 1%? And it becomes a negotiation. Come on, guys, 1%? And been successful, and you always have your naysayers. But the way I look at it is you've got to be willing to take a risk. You have to have an intelligent business case with some assumptions. But if you won't take a risk, then what I can tell you is what you have today will probably deteriorate, maybe at best stay the same, but your position in the marketplace will decline.
So you talked about risk, and that brings another point to mind, what I would call an objection that I've heard from different organizations as we've talked to them about employee engagement. And you talked earlier about listening tours, and listening tours being sort of point in time and often very sort of structured and managed. And I know that you've seen, as you bring in capabilities like the ones that Blink provides, you are sort of opening up the opportunity for employees to engage in ways that they haven't before. And I think there's a little bit of fear there on some leadership, on the leadership side, that you're perhaps opening up Pandora's box. And I'd like you to just hear your opinion on that, and what you've seen in practice as well. You mentioned Gen Z, you mentioned the gig economy. I think some of this is changing, and yet I do still see some fear of opening up that communications pathway, if you will, or how broadly one opens it up. What have you seen?
I've seen a mixture of folks being willing to open things up, to pilot things, to test things. And it throws me back to when the internet was becoming pervasive in organizations, and, we clamped it down. We didn't give people access. And I was totally on the other side. I stood in front of my organization and said, we're opening it up. You can have it on your desk. If you can, you need it as a tool for your job. I said, do what you want, go to whatever websites you want to, whatever it is you want to do, but just know this: we're treating you like professionals. We expect you to act like professionals. And if you go to places you shouldn't go, we're going to know it. And you're going to get to go to them all day long at home. And so the problem that we're trying to solve now of employee satisfaction, engagement, commitment, loyalty, helping them be better at their jobs, helping them feel trusted, respected, and appreciated, right? I think those are three core things that need to exist. We can't hide from that. We can't try and keep them away from the tools that they need to do their jobs to be successful. If we do, we've fundamentally told them that they were right to be dissatisfied, disengaged, and from the employer perspective, disloyal. So you got to take the risk. You've got to, if you don't help them, they're going to find a way to do it themselves, or they're going to leave.
I'm looking to see if we have any questions. If anybody does have any questions, they can certainly pop those into the Q&A. But so sort of that risk of opening up that communications pathway could be one potential objection, or in some eyes, a potential pitfall. I'm just curious, Ian, any other sort of pitfalls, common pitfalls that you've seen as organizations have tried to embark on an initiative like this that you would sort of put out there for others?
Yeah, I think the first for me is rushing headlong to solution before you truly understand the problem. Right? It's the epitome of arrogance, is thinking you know what everybody wants before you actually take the time to understand them, their position, and what's important to them. And you see that very often where people may take a survey, sit in an office and say, okay, we're going to do this. But they really don't know if this is going to have an impact. I think another one is rapid change of direction. Life is what happens in between the plan. And we have plans, and every day something happens differently. Do we continue to introduce a new solution? This month, we're going to do a survey, and then we're going to share the survey results. Then we're going to have a listening tour. And then we're going to do, have birthday of the month parties and all types of things. And it just keeps changing and changing. And when the employees don't see the follow through, they become numb to the activities and frankly, disengage at another level. Hyping communication efforts, but again, telling what the corporation wants to tell, the story that they want to tell, versus what employees really need to and want to hear. And I'm not saying tell them what they want to hear in terms of change your message, but what is it that is important to them to hear, and from who do they want to hear it from? From. The last one, Marcy, I would tell you is talking at the employees versus talking with the employees.
So I was going to, sort of prompt you there too, similar to that. We've talked a lot about frontline engagement. We've talked a little bit about digital transformation, and we've talked about technology. I mentioned that I'm on site here at a hospital system speaking to a lot of frontline workers in various roles in the organization. And I really think we have to be cognizant of the fact that those of us who have been in an office since the internet came on, and Ian, that would be both you and I, and we've been subjected to technological change over the years from an enterprise software perspective. We put up with a lot because we're used to it. But it is always eye-opening to me that there's a lot of folks who don't have that experience and expect something very different. I guess my point is, when it comes to a simplified experience for the front line, how important have you seen that we create an experience specific for the front line that's targeted to them versus perhaps porting things that have worked for a desk-based employee and try to port that out to the front line? Have you had experiences with that?
Yes, I've seen a lot of that. And what I would tell you is that many organizations have been comfortable in building solutions for tethered employees, folks or that are in the office or working at a desk all the time. And So you have more time, you have people around you, you have communities of help. Whereas when you're a frontline employee, a worker, very much you feel like you're on an island sometimes by yourself, and the solutions that you need to be quicker, more succinct. You can't spend a lot of time signing in, navigating. You need to get to your answer now. You may be doing it while you're in front of a patient, or in the case of home health, in between patients, but you don't have a lot of time. And so they need to be sort of hub-based, all-inclusive, and easy to navigate, and really get you to what you need quickly.
Ian, we're getting close to time here, and I do have a question from the field, so I'm just going to read this out. With the challenges of hiring and recruiting talent, managers are tempted to desperately hire any candidates, even though they may not be as qualified as desired for a frontline position. The question she's received is, or he's received, do we hire that person to help alleviate the stress and burnout of current employees, or do you wait longer and risk losing more people? So that's some of that recruitment constraints that we've seen, and finding the right candidates. I'm sure that's part of that cycle of recruitment and attrition. You've been in this person's shoes, Ian. How would you answer that question?
So my personal opinion is you wait, and you help the team understand, because an absence of a resource puts pressure on the team. Bringing a bad team member to the team is not a good idea. Mm-hmm. And I think one way to help the frontline, the team understand that, is engage them in the hiring process, because nobody ever wants a bad teammate.
That's a good point. Okay, Ian, any closing remarks before we turn this back over to Hannah to just bring the webinar to a close?
Sure. To me, folks, right now where we are in the market, in the business, with the challenge that we're all experiencing from a frontline and just general employee satisfaction, leadership, loyalty, engagement, and the impact it has on our customers, I would argue that this right now is our real test of leadership. And the question that we have to ask ourselves is, are we more worried about playing it safe, trying to protect our jobs, at least in the short term, because we know the implication that it could happen? So are we willing to then, or are we more committed to doing what's right for our employees and our customers, and ensuring that we create the necessary environment where customers can be satisfied and employees can feel trusted, respected, and appreciated?
Well, I certainly appreciate your time today, Ian. It's been a pleasure speaking to you about frontline engagement.